The key to any medical consultation is detailed history taking. It's often said that if by the time you finish taking the history you don't know what the problem is, you're in trouble. The project that we've been working on for about 4 years is to use video conferencing equipment to provide clinical consultations to people who are in hard to reach locations. And the location we've been looking at principally is the prison service. We bought off-the-shelf business standard video conferencing equipment, which in essence uses a large television, a standard video conferencing camera which we use for the majority of the consultation. But when we need to look at areas in more detail, we have a small handheld higher magnification camera, and it's really no different to taking history in a face-to-face situation.
The very first thing we did was to actually set up telemedicine between two of the rooms in the A&E department so that we could see some patients over the link and then pop next door and see them in real life and see whether we felt the information we'd got over the link was good or good enough compared to the information that we got when we saw them in real life. We then moved that slightly further afield with the GPs in Settle and tried some patients up there before we rolled it out to the prisons.
We're receiving a variable number of referrals. For example, one day last week we had 12 individual referrals come in on the same day. So the service is building up in terms of volume. It looks like this is the call that's coming now.
Hi, it's Andrew here, staff nurse at Full Sutton.
Hello, it's Dr. Pope from Airedale. In the room with me I've got Julie Pullman. So can you tell me what the problem is?
Yeah, I've got Dina here. She's presented to me this morning with these growths that she's got in her eyes.
Right. And are these things actually in your eye or on the top of your eye? Where we'll have a look in a second in detail, but where do you feel they are?
They're on my eyelids.
On your eyelids, okay. Can you perhaps show us a more close-up picture of the eye now by switching to the handheld camera, please? Okay, I can see that really clearly. Is it possible that you could unfreeze it and put it back on Dina's eye for me? Thank you, that's great.
For us, it means that we can get a better service for the prisoners that we care for. It's a high secure prison here, so it has constraints in terms of being able to get prisoners outside into the community, into the mainstream hospitals to be seen.
Sometimes they don't need to go out to see an outpatient appointment consultant, and they can just be dealt with over the video link.
We have lots of our patients don't go out, who refuse to go out to the local trust because they don't want to go out cuffed, they don't want to go out in high visibility suits. And I think what we found is a lot of them would prefer to kind of go for the telemedicine route, to actually do that because it's private, it's a clinical consultation and it's no embarrassment.
A lot of them actually quite like the idea of being on camera. And also obviously from the health point of view and the financial point of view, that it saves a tremendous amount of money.
For us, if the nurse has got access to the recommendations of a consultant readily, either for trauma or for the second opinions, I think it gives a lot more confidence.
The prison nursing staff, I think, find it very reassuring to know exactly what needs to be done with a patient, so that they know it's the right decision, that a patient needs to go to hospital to have x-rays done. And sometimes we're able to reassure them that it's not necessary and the patient can just be reviewed in a week or so later to see what their progress is.
I'm a nurse myself, and I just know it's that confidence that you need to say, I'm sending them out or I'm not, because you make the wrong decision and it can have really serious consequences for the whole of the healthcare team.
That's right. I mean, this is we're talking about safety and raising standards. We're not trying to bring anything in on the cheap. This is something that's going to raise standards, make things easier for the doctors and the nurses involved. And as long as this is just another link in the chain of improving our overall care, then it should be encouraged.
When we started this work, we always felt that whilst the prison population would be an important first development for the use of this technology, that the real benefits would be to deploy it at scale in the mainstream NHS environment. We live and work in a very rural location here, and for some of our patients it can take over an hour to drive down to the hospital from their home. So as part of this rollout process, we've established a similar link with a general practice at Settle in North Yorkshire.
We've run a telemedicine diabetes clinic. We've got an 18-year-old patient who is struggling to attend their diabetes clinic. In actual fact, it re-engaged him, knowing that he could come only intermittently to the hospital, but we could actually still stay in touch with him and help him with his diabetes through the telemedicine link.
By using experienced clinicians at the receiving end of the link, we're able to deliver that breadth of clinical opinion and expertise, and in about 3/4 of the cases that we're being asked to see, we're safely and appropriately treating people in the remote location.
I think what we're doing, what we've done so far is very exciting, but the potential is huge, and I think particularly putting telelinks into nursing homes to support the nurses there could be really important, and I think that has big implications for improving healthcare for our local population.